Antibiotics save millions of lives every year, but improper use can lead to dangerous complications, including antibiotic resistance. In this video, we'll explore 6 critical factors every healthcare professional must consider when initiating antibiotic therapy. Stay tuned as we break down these life-saving guidelines, supported by updated, accredited medical references like the CDC, WHO, and BPS clinical guidelines. The first and most crucial factor is ensuring a clear and accurate indication for antibiotic use. Not all infections require antibiotics. Viral infections like the common cold or influenza won't benefit from these drugs. Always confirm the infection is bacterial, supported by clinical presentation and diagnostic tools, such as procalcitonin levels or blood cultures. Before starting antibiotics, consider pathogen identification through cultures whenever possible. Knowing the specific microorganism allows for targeted therapy, reducing unnecessary exposure to broad-spectrum antibiotics. For example, identifying Staphylococcus aureus versus Escherichia coli can drastically change your treatment approach. Selecting the right antibiotic involves understanding its spectrum of activity. Choose a drug that targets the pathogen with minimal collateral damage to the microbiome. For instance, use narrow-spectrum antibiotics like penicillin for streptococcal infections, reserving broad-spectrum options like carbapenems for severe resistant cases. Getting the dosage and duration right is vital. Underdosing can lead to treatment failure, while overdosing increases the risk of toxicity. Always follow evidence-based guidelines for dosing adjustments in patients with renal or hepatic impairment. Moreover, avoid prolonged courses unless clinically indicated, as they can increase the risk of Clostridioides difficile infections. Always account for patient-specific factors, including allergies, comorbidities, pregnancy, and age. For example, in penicillin-allergic patients, consider alternatives like macrolides or cephalosporins, depending on the severity of the reaction. Remember, drug interactions can affect efficacy or increase toxicity. Check for potential interactions with anticoagulants, antiepileptics, or other commonly used drugs. Finally, always monitor the patient's response to therapy. Watch for clinical improvement and assess for potential side effects like nephrotoxicity with aminoglycosides or QT prolongation with macrolides. Reassess therapy based on culture results and de-escalate to narrow-spectrum antibiotics when appropriate. Regular follow-up ensures treatment effectiveness and minimizes adverse outcomes. Antibiotics are a cornerstone of modern medicine, but their effectiveness hinges on our responsibility to use them wisely. By considering these 6 critical factors, you not only enhance patient care, but also combat the growing threat of antimicrobial resistance. If you found this video valuable, don't forget to like, comment, and subscribe to stay updated with the latest in clinical pharmacy and healthcare practices.